Members of the jury, today you will learn about a tragic death caused by a horrible illness and a powerful drug. On June 2nd, 2018, Ava Johnson, a 17-year-old student at Hofstra High School, had a severe lupus flare-up. On that day, her doctor increased the corticosteroid she was taking to over double the amount. You will learn today that that steroid, prednisone, combined with her diseases, caused Miss Johnson to suffer horrific physical pain. Mental illnesses that evolved into extreme depression that led her to commit suicide by throwing herself in front of an oncoming train. Good afternoon. My name is Dan Orscannon, and along with my co-counsel, Elizabeth Grande, we represent Hofstra High School. Ladies and gentlemen, Hofstra High School never knew Miss Johnson was suffering from lupus. They never prescribed or had knowledge of the prednisone she was taking. The evidence will show that Hofstra High School is not responsible for Miss Johnson's suicide. Her death was a result of illness and that steroid, prednisone. You see, Hofstra High School had no part in her treatment regimen. They didn't prescribe her medication or cause her mental instability. The lethal combination that led to her delusions, paranoia, and suicide. That ultimately caused Miss Johnson to take her own life. If there is blame to be placed, members of the jury, it is not on Hofstra High School. It was a tragic illness and treatment that caused her death. Now, what plaintiff just told you is not what the evidence will show. It's what they want the evidence to show. Because what the evidence will show is that Miss Johnson's suicide, though tragic, was not the result of what they claim: bullying. Miss Johnson suffered from SLE, systemic lupus erythematosus. It's a chronic autoimmune disorder with no cure. Today you'll hear that Miss Johnson experienced a broad range of physical conditions: substantial weight gain, frequent episodes of pain, hair loss, rashes on her face, and lesions all over her skin. All of those symptoms are caused by her lupus. Now, her doctor prescribed her prednisone, originally 40 milligrams a day. It eased the physical pain, but came at a cost: extreme mental issues. You see, the prednisone used to treat lupus had psychiatric side effects, often unpredictable and severe. Now, these side effects include anxiety, paranoia, hallucinations, and an increased risk of suicide. But ladies and gentlemen, only Miss Johnson and her doctors knew what was happening, not Hofstra High School. Today you will hear from Miss Johnson's best friend, Jamie Lee. She will take this stand and tell you how she was best friends with Miss Johnson since the 5th grade. How everything changed during the summer of 2016 because of medical issues. They were about to start 11th grade when Miss Johnson was diagnosed with lupus. Now, her doctor prescribed her medication, and she confided in Jamie Lee about it. She told her that the medications she was taking made her have horrible mood swings. Cheerful one minute, and depressed the next. By the time they got to senior year, things had gotten much worse. Miss Johnson stopped acting like herself. She declined invites from Jamie Lee to go to the movies, to have sleepovers. She completely isolated herself. Then Jamie Lee will tell you about the week of prom. How Miss Johnson began acting increasingly erratic. This time her bizarre behavior, it wasn't just mood swings or physical pain. She became paranoid. She was having delusions, visual hallucinations. She thought people were watching her, following her. She even accused her best friend Jamie Lee of recording their conversations. Now, Jamie Lee won't be able to explain to you why these things were happening, because she didn't know. Nobody at Hofstra High School will be able to explain why these things happened, because they didn't know. But ladies and gentlemen, what we now know is that on June 2nd, just 1 week before prom, Miss Johnson had an extreme lupus flare-up. That's when her doctor increased her dosage of the prednisone she was taking to over double the amount. 100 milligrams of prednisone, a dosage 2.5 times more than what Miss Johnson was used to taking. Miss Johnson's body, her mind, could not tolerate the increase. Her symptoms exploded. Mentally, her life was out of control. But the plaintiff wants you to believe that it wasn't her disease, it wasn't her prednisone that caused her to commit suicide. They want you to believe that it's what other students did or said. Members of the jury, that's absurd. Miss Johnson was harassed by other students, but there will be no evidence, nothing, that connects what other students said or did to the cause of Miss Johnson's suicide. In fact, the evidence will show that Hofstra High School is and has always been sensitive to issues regarding bullying. They had a zero tolerance policy, and you're going to see that policy today in their code of conduct. You're going to see just how seriously the principal, Adam Golden, took that policy. They even appointed the high school guidance counselor, Blake Davis, to oversee that policy. But that's not it. They even had a contract that all the students going to prom had to sign, outlining that Hofstra High School would not tolerate any bullying at prom. Hofstra High School did everything they could with the information they had. They were never told of any of Miss Johnson's conditions. They never had access to her medical records, and they surely didn't control the amount of prednisone Miss Johnson was taking. Now today, in addition to Miss Lee, we're going to call an expert in this case, Dr. Sam Wolf. Dr. Wolf is a board-certified doctor in rheumatology and internal medicine. She will tell you about lupus, about how it causes the body's own immune system to attack various parts of the body, the joints, the organs, but most importantly, the brain. She will tell you about the mood and behavior disorders caused by lupus. The most common? Depression. Dr. Wolf will explain how depression can cause patients to feel sad, irritable, worthless, and even misunderstood. It leaves them with a loss of interest in things that they used to enjoy. Now, she will tell you that Miss Johnson was experiencing all of those symptoms. That adolescent patients like Miss Johnson are more likely to commit suicide. Not one, not two, but 7 times more likely. You're going to hear some other grave statistics today. Dr. Wolf will tell you that 1/3, that's 1 out of 3 patients on prednisone, experience what's called suicidal ideation, that they envision themselves committing suicide. And that's with the dose as low as 50 milligrams. Imagine what 100 milligrams could do to a teenage girl. Now today you will learn that dosage is the most important risk factor in a patient developing psychiatric symptoms. Simply, the higher the dose of steroids, the more likely the side effects. Dr. Wolf will tell you that Ms. Johnson's lupus, combined with the increase in her prednisone just the week before prom, is what led Ms. Johnson to commit suicide. Now, members of the jury, you don't need to be an expert. All you really need is your common sense. Common sense tells you that being bullied or harassed, it may be hurtful, but it doesn't cause you to hallucinate. It doesn't cause you to become paranoid and suicidal. And for Ms. Johnson, none of these things happened until her prescription of prednisone was increased to 100 milligrams. The psychiatric effects were obvious immediately, within just 48 hours. Ladies and gentlemen, that is not coincidence. That is cause and effect. Her death was not caused by mean girls. It was caused by her disease, her mental illness, and overly prescribed drug therapy. Now, at the end of this trial, my co-counsel, Elizabeth Grande, will come before you, and she's going to ask you to acknowledge that what happened to Ms. Johnson was a tragedy. But it was not because of Worcester High School. Find Worcester High School not liable for the things outside of their control, for the things out of Ms. Johnson's control, and for the fatal consequences of medications and diseases that they knew nothing about. Find Worcester High School not liable for the death of Ava Johnson. Thank you.